This is inferior surface of liver, and you can see various impressions. That's enough. And you can see the lobes. This is lobe. This is lobe of liver. This is caudate lobe. Remember, examiner may ask you to identify certain things. This is caudate lobe. This is roughly quadrate lobe. Caudate lobe, inferior vena cava. Look here, I am tracing downwards. Most important, gallbladder. Examiner may ask 2 or 3 landmarks in specimen. We have already started our offline lecture. So what is purpose of this video? Yes, that is question mark. The purpose is to keep momentum. That is momentum between first Thursday to next Thursday. Yes, that is a momentum. Second purpose is read less techniques. Students should read less, and of course preservation of e-content for NAC. Now what I did in first specimen, dissected specimen, I shown you the liver, but we can't see the lobes clearly. So after dissected specimen, from specimen I went to model. Look here, I shown you the demonstration of model. So first specimen, then model, and now I'm explaining you what is usual question. Enumerate the lobes of liver. Right lobe, left lobe, caudate lobe, quadrate lobe. Describe any 1 or 2 lobes. Of course, I'm going to describe caudate lobe, porta hepatis, and quadrate lobe. Now, caudate lobe is bounded by inferior vena cava. Yes, I shown you this in the model. Bounded by inferior vena cava and porta hepatis. Yes, only 2 boundaries are sufficient. Don't write other boundaries like ductus venosum or ligaments. Yes, it is bounded by inferior vena cava. I am repeating, inferior vena cava, inferior vena cava, inferior vena cava. I repeated it 4 times. And porta hepatis, porta hepatis, porta hepatis, porta hepatis. So what are structures entering in porta hepatis? Yes, of course, this is inferior vena cava. Most important, I traced it down. This is caudate lobe. This is quadrate lobe. See, this is Q. This is C. This is caudate. This is quadrate, quadrate lobe. Yes, this is quadrate lobe. And porta hepatis. What are structures entering in the porta hepatis? That is portal vein and hepatic artery. And what are structures leaving? मतलब बाहर कौन जा रहा है? That is hepatic duct. So porta hepatis के अंदर कौन आ रहा है? Yes, that is portal vein and hepatic artery. और porta hepatis के बाहर कौन जा रहा है? That is hepatic duct. So this is a purpose of first showing dissected specimen, followed by model, and followed by explanation of particular lobes. Of course, right lobe, left lobe, caudate lobe, and quadrate lobe. This is caudate lobe. Quadrate lobe, boundaries of quadrate lobe, inferior vena cava. I shown you in model. I shown you in the model inferior vena cava. Now I am teaching with blackboard. So connection of model with blackboard teaching. Look here, this is model, this is specimen, and this is connection of blackboard teaching. So inferior vena cava. This is commonly asked in practical. This is commonly asked in practical exam. So inferior vena cava, porta hepatis. So porta hepatis में enter कौन करता है? Hepatic artery, पोर्टल वेन. आई एम रिपीटिंग, एंटर कौन करता है? हेपेटिक आर्टरी, पोर्टल वेन. बाहर कौन जाता है? लुक हियर, लुक एट माय थंब. बाहर कौन जाता है? बाहर जाता है, दैट इज हेपेटिक डक्ट. अंदर कौन आता है? दैट इज पोर्टल वेन. हेपेटिक आर्टरी. बाहर कौन जाता है? दैट इज हेपेटिक डक्ट. ऑफ कोर्स क्वाड्रेट लोब. At the most 2 boundaries you have to remember. Again porta hepatis, look here, and gallbladder. And along with gallbladder, they can ask certain questions. Rarely they may ask development of liver. Just remember one word, at least one word, that is hepatic diverticulum. That is from the endoderm of foregut. Hepatic diverticulum. I'm a bit slow. Hepatic diverticulum from the endoderm of foregut. Of course, we shall cover development in detail in our offline lecture.